Welcome, healthy friends, and those of you trying to be healthy, to the Reality of Health podcast. We're going to change it up a little bit today and ask the question, can you diagnose yourself? But Eric, I thought this was a health channel. Don't I need a doctor to diagnose me? Nope, you don't. Well, some cases you do, but most of the time you don't. So let's get into it. No one knows everything about health because basically everybody's constitution or individuality is different. Physiologically, we are all the same, but individually, we are not. Can you really diagnose yourself? I say for the most part, yeah, you can. People just want answers. How? When? Where? Why did this happen to me? How about the question, what? Well, that one is the real question. That one is the question, what is wrong with me? Once you know, then you get your relief. I can test you already know what's wrong with you. You just have not realized it yet. You already know. When it started, you just forgot. You know when you got sick, you just can't recall. You already have the answer, you just need somebody to work it out in your mind with you. So what is a diagnosis anyway? Quote, it's the act or process of identifying or determining the nature or cause of a disease, unquote. So then you go get all these diagnostic tests. I would contend most don't mean anything. There's maybe a couple that are useful, but most all of those, in my opinion, are based on genetics, which basically don't exist, or markers and antibodies and all kinds of things that really just, well, don't exist. I think we'll have an episode in the future about diagnostic tests, but suffice it to say that most, let's call them alternative practitioners, really don't care so much about them either. And if they do, then are they really alternative? Here's a quick thought for you. We all think our bodies are constant. That if you take a blood test right now and then you take a blood test tomorrow at the same time, they're going to be basically the same. Well, guess what? They won't be. This is why they tell you to not only drink just water before a blood test or other test, because they're trying to establish a baseline. Since they believe that everything is a particle, they want to remove as many particles as they can, like sugar and things like that. But what if you were on your period? And for men, what if it was the full moon? What if you play a sport the day before? What if you eat toxic food the day before? What if you had a very stressful situation like a death of a loved one? Boy, your hormones go all over the place. Point is, there's too many factors involved with testing. But Eric, surely the tests are useful. Well, I know of practitioners who don't test anyone and don't test themselves because they know they are mostly inaccurate and at best, sometimes, give the same info that a thorough evaluation would give. They don't care about the numbers. Me personally, I don't really care about the numbers all that much because your body is always changing every minute, every hour, every day, every week, every month. So then you get a diagnosis and you decide to use supplements, or you tell your doctor you want to use supplements. And then you take that supplement and it fails. Why? Because you're different all the time. Your reason for being sick is different than maybe other people, even though they're all associated with, let's say, a nutrient deficiency or a toxin or a poison or anything else. So to give the same protocol to everybody doesn't mean everybody's going to get healed. This is why medical doctors don't believe in supplements, because your testimony is the diagnosis. So let's illustrate this. Let's take 3 people who experienced, we'll call it headaches. And now we're going to ask them their testimony. What hurts? My leg. When did it start? Maybe 2 years ago. What happened 3 years ago? I don't know. Do you have a life event, maybe? Yeah, actually, I changed jobs. When did it start hurting worse? Well, it hurts all the time. Is it in the morning or afternoon or evening? Afternoon and evening mostly. Is it worse at work or while driving maybe? It's definitely worse at work. Do you sit at a desk all day? Yeah. How many times do you get up? Not much. Did you always sit at a desk in your career? No, I was mostly in the field. What kind of chair do you sit on? Do you exercise? Do you stretch? Do you go for walks after work? You see, then you get this person's testimony. Then you get to the issue. They sit at a desk all day, no exercise, and now you need to figure out a regimen. They don't have nerve damage needing cortisol injections or anything like that. They need to change the way they work and what they do after work. So, now what we have is doctors will diagnose you with something, and then they'll use the Latin for your symptom. Let's take eczema. Did you know that's Latin for rash? Yeah. Pruritus. Well, that's Latin for itchy. So like, if you had an itchy
anus,
then they would call it pruritus ani. Then let's say you had symptoms of diabetes. So then they would say you have diabetes mellitus, which just means sweet urine. Guess what that's from? Too much sugar. The Greeks used to diagnose people with diabetes by seeing if the ants would consume their urine.
What? Ew, no.
Now we have much more expensive tests and also have to break your skin to test your blood. So then they use the number like A1C for sugar that indicates your disease. Well, that's not your testimony. You are not a diagnosis. Of course you feel some mental emotional relief. Now you think you know what is wrong. But all they did was describe your symptoms with a noun, a title. They don't tell you how or when or what or where caused the title or diagnosis. They seem to actually not care why you got sick. They can't associate that with how it happened, and so you don't know to not do that again. All you got was a test, a report, a diagnosis. Let's break down what actually happened. You went into the doctor, you told them your symptoms, and then they ran some tests, maybe, and then came back and said, yep, you have arthritis. Really, doc? I could have told you that. Oh, don't worry. Your condition that they determined you have, they made it sound really official by using that Greek translation. Like pruritus ani, itchy anus. I am by no means stating that they don't sometimes really do figure some things out, like an MRI finds a tear in your shoulder cuff. What I'm talking about is diagnosing you with a regular condition or sickness that you actually feel. Hey, doc, I don't understand why I'm kind of tired. I don't sleep well. Gained a lot of weight and I have no sex drive. Does the doctor ask you about your diet or lifestyle? I guarantee 100% he doesn't. You want to know why? Because they now can't question your lifestyle in the medical profession. What they should do is say, well, what have you changed in your life recently? When did it start? Well, I got a divorce and I've been eating a lot of sugar and fast food because I don't cook for myself anymore and I'm starting to drink a lot. I know that's a crazy example, but that happens every day, all the time. Here's a more serious example. Doc, I don't understand. My heart is racing all the time. I've got high blood pressure. So many times throughout the day, I feel like my blood sugar is low. The doctor should ask, when did this start? And you would say, about 6 months ago. Then the doctor would say, what did you change in your life? What did you do? Nothing really. Doctor would state, what happened 7 months ago? I don't know. Oh, wait. I know. I started dating again. Doctor could say something like, what new thing are you doing that you didn't do before? I don't know. I mean, when I meet somebody, we go to like a coffee shop. Doctor should say something like, that's interesting. Did you get hooked on coffee? Wait a minute. Did you drink coffee before you started dating? No, not really. I really don't like coffee all that much. I'd have a cup here and there. You see how this goes? There are so many things in your life that are subtle that you wouldn't notice unless you looked back at your testimony. The coffee interrupted his blood pressure, his energy, and his blood sugar. Here's another quick one. Someone's got pain in all areas of their body. Doc says, when did it start? You say, I don't know, a year ago maybe? Doc says, what happened 13 months ago? I don't know, nothing out of the ordinary. Doctor says, did you get sick from food or did you travel? What happened in your life that was unusual? Well, nothing's really all that unusual, but I got my first flu vaccine. A good doctor would say your symptoms are caused by the vaccine. You see, your life is experiential, and there are outcomes based on choices you have made. If you investigate a little bit into what happened prior to you feeling like this, the answer is usually sitting right there in front of you. Life happens, and the answers to your sickness or your condition or your symptoms usually started with something. It is this something that was very small, or if it is something that was very small that built up over a long time, well, that requires deeper diagnostics. But most things can usually be traced to something right before your condition or symptoms. Sometimes it helps just running this by somebody you know. Ask the questions of each other. You see, you can diagnose yourself. You don't need expensive tests, invasive tests. You can just simply look at your testimony. That's going to determine almost all things that have happened to you or are actually happening to you right now. Then, if you can't get answers, that is when you seek help. If there's any topic you want to learn about, you want me to discuss, feel free to let me know. There's lots of ways to get a hold of me. If you haven't subscribed, please subscribe, follow, all that cool stuff. It totally does help me. Thank you for listening. Please take care of yourselves.